All right. Can everybody hear me on the online portion? If somebody wants, just give me like a thumbs up. I see a thumbs up. We're good to go. All right, let's get started. Hello, everybody. Welcome to the February edition of the DuPage ROSC Council meeting. As always, my name is Jared Burton. I'm your ROSC coordinator, as well as a person in long-term recovery. If we could start by making sure everybody on the online portion keeps their microphones muted, unless it's time to share, and that will help us cut down on interruptions. Otherwise, my colleague Danny Sorbitz has a very trigger-happy mute finger. We hope we don't have to use it, but he's here just to be on the safe side. And also, if you could make sure, if you put your name, organization, if applicable, and contact into the chat, that helps us to keep attendance, which we report back to the state. And everybody here in person, if you haven't had a chance to sign in after the meeting, if you would, that'd be awesome. Real quick, before we get started, I did want to take a moment to kind of speak about something. I usually take a couple minutes before some of the meetings to speak about something that's timely, and I wanted to bring up self-care for a minute. We all know how stressful this field can be, the field being substance use and mental health and all those things that go along with it on the continuum. But especially with the amount of anxiety and confusion that's been happening around not only funding, but like political climate, et cetera. I think quite a few of us are people with lived experience, meaning we are either in recovery ourselves or we have friends or family members who've been touched by the disease of addiction. And self-care is really important. And it should be something that we're practicing and not just kind of using as buzzwords in our daily life. So I'd like to challenge everybody before we get started to do something today to practice self-care. So whether that's maybe giving yourself an extra hour of sleep, if that's possible, taking a long bath, practicing positive self-talk, or even something as simple as just shutting your screens off early tonight. Before we get into today's agenda, I would love to hear about some ways that maybe you practice self-care. If you have something in the chat, you can go ahead and put it in that, or if you've got something here in person that you do that you want to maybe let everybody know about, you could do that. I will start. This year, I've actually gotten into refurbishing old furniture. So I have a couple of old bookcases that I've been sanding down so I can paint them. And then my colleague Annette was like, do you sell them? No, this is just for my personal use. Maybe down the line. She was like, you should get an Etsy shop. There was all kinds of plans. But I find that even just doing things like sanding down furniture, it seems like kind of menial or mindless stuff. That's what self-care is to me. I need things like that where I can just kind of shut my brain off for an hour or two. And working with my hands is like very, very cathartic. And actually in my car right now, I have a bookcase I'm taking home today to start work on. So that's something that I do. If anybody here wants to give an example of what they do, or if there's something in the chat, I'm going to read out some of these. Michelle, our friend from the VA, has started coloring, keeps her off her phone. I think that's a good one. Prioritizing from Sarah, prioritizing getting enough sleep. Jordan from PLT, not enough 6 a.m. workouts is my favorite form of self-care. Anybody here have an example of self-care? All right, Jen, our own team member, Jen. We're going to bring around the Price is Right microphone.
Hold it. I do diamond art every night before bed for like a half hour, 45 minutes, just to kind of wind down so I can fall asleep easier and quicker. And it's, it's very entertaining, but it's mindful. You have to, focus but not a lot of work. So.
Excellent. All right, what else we got here? Ava from the Language Access Resource Center says knitting. We've got some folks who like building Legos. That's Nicole from RCA. Our friend Ben Rudolph from our TA for Region 2 likes to play his piano and sing. And many of you may not know this, but Ben used to play jazz piano at the Green Mill in Chicago. If anybody here knows the Green Mill, really, really great kind of legendary Chicago club. So Ben is way cooler than most of us from being able to do that stuff. Our friend Mimi Dahl running and reading, not at the same time, although you could probably do that with an audiobook. Vents going on nature walks when it's warmer. Oh my gosh, you guys, these are amazing ideas. So I think this goes to show that there are plenty of ways that we can practice self-care and not just talk about self-care. So I hope that everybody goes home today and does something to kind of challenge themselves to do that. So thanks everybody for sharing those. I'm going to go ahead and share my screen real quick. Let's find the many things that I have open. Okay. First of all, I've started to ask this. Is anybody here at their very first DuPage ROSC meeting? If you were here in person for the first time, you can raise your hand. Okay, we're going to get to you in just a second. If you're here, oh my goodness, the dog under the table accidentally kicked. I'm sorry, Maple. If you're on the online portion, you can raise your digital hand. But why don't we do the in-person first? We had one person, Annette. We want to make sure we get the game show mic over there.
So nice. Hi. Oh, is it working?
Yeah, as long as it's on, you should be good.
Oh, perfect. Well, hello, everyone. I'm Annie Jaworska. I'm the new director of professional relations at Gateway Foundation. And I'm here with Julie, who is on my team, and just really grateful to be here with all of you. And also, as a side note, I am also on the board for the Addison Township Mental Health Board, and we have a meeting tonight at 6 p.m. Everyone is welcome. So if you'd like more information, please let me know.
Excellent. Welcome. Glad to have you here. I do have a couple of digital hands. We're going to go with Judith first. Judith, welcome. You know what? We're going to have you on mute, Judith, if you don't mind.
Do you want me to talk?
There
or
we
no?
go. Yeah, we can
Okay.
hear you.
Yeah, I had gone to a meeting at the health department, DuPage County Health Department, and a member of ROSC was there and spoke. But this is my first ROSC meeting, so.
Great. Glad to have you here, Judith. Thank you.
Thank you.
And then Liza, you got your digital hand up.
I am from DuPage COD. I'm doing their CRSS certification.
Beautiful. Are you
grant.
here through Bruce's class?
Yes, I am. Just actually
Excellent.
he went long and I said I need to go.
Well, I'm pretty sure that Bruce puts attending ROSC meetings on the syllabus now, so we're glad to have you with us. And I see another hand, a couple more. Bridget.
Hi, I'm the same as Liza in Bruce's class. And Liza actually reminded me that there's the meeting today. So
Great. Glad to have you here,
Here.
Bridget. Thank you. And it's been a while, but we've finally got Jordan Esser with us. I know that usually our schedules don't match for this particular meeting, but we're thrilled to have her here. So Jordan, if you want to introduce yourself, I'm sure most people know you already, but go right ahead.
Thank you, Jared. That's the best intro I've ever had to a community
Thank you.
meeting. I am so excited to be here. I've been wanting to come to these meetings for a while. I hear how amazing they are from my colleagues and other people. So it was a priority of mine for 2025. So I'm happy to join you for the February meeting, and it's on my calendar going forward. I'm Jordan Esser. I work at the DuPage County Health Department, and I lead the prevention leadership team, which ROSC and Jarrett is a huge part of. And we focus on the continuum of care model. So prevention, treatment, recovery, substance use prevention, misuse, and mental health initiatives. So very excited to join this table and continue our partnership.
Great. Thank you, Jordan. And we also got Liz King. If you want to go ahead and come off mute, Liz.
Hi guys, I'm Liz King. I'm with Relief Mental Health. I have worked with Jared and Danny in the past, but have not yet been able to come to one of the meetings, so happy to be here. Relief is a provider of transcranial magnetic stimulation, or TMS. We also provide nasal S-ketamine, Spravato, IV ketamine, medication management, and therapeutic services. We've got 7 different locations around the Chicagoland area, and I'm happy to chat with you guys. Thanks.
Excellent. And we've actually got Don coming on here in a little bit to talk more in depth about those services. So glad to have you with us as well, Liz. Thank you. All right. Great to have so many newcomers here. This is awesome. So to that end, because there are so many new people, it'd probably be helpful to kind of describe what it is that a ROSC does. So the ROSC stands for Recovery Oriented System of Care. It is a model that is being used all over the state, but also all over the country. So kind of our central focus is to create a more coordinated network of people and organizations, like I said, that kind of work along that recovery continuum. So we look beyond just the acute care stuff of like only detoxes, only treatment centers. We really want to look at treating a person's entire life and all that entails in recovery from substance use and mental health challenges. So that's going to look at also things like housing, employment, some other intersectionalities like domestic violence, anger management, basically all those things that a person in early recovery might deal with, but also sustained recovery. We really want to get all those types of people and organizations together to kind of create a more streamlined system of care. And one of the ways we do that is by identifying the strengths of our area, but also the gaps in services. So, you know, by doing that, it kind of helps us to steer the ship, as it were. And we'll talk about some of the ways that we've been doing that as we get into this. But this is kind of what the ROSC model is. And you'll learn more as I kind of promote some things here in the next few minutes about what specifically the DuPage ROSC is doing. So let's real quick go over the agenda. Like I said, we're going to go over some of these upcoming meetings and trainings because there's quite a few of them. My buddy Danny, who heads up the Serenity House CORES program, will talk a little bit about some of the stuff that they're doing. Blake Warman, who's our colleague that helps out with ROSC stuff, is going to talk about the WhatsApp referral hub, which a lot of you are a part of. And if you're not, we'll tell you what that is and how to get involved. But also the ROSC resource guide and map. A lot of you have gotten the resource guide that Blake has worked very, very hard on. But it also now includes a geographic function. So we're going to take a look at that and how you're going to be able to utilize that in your own life. After that, like I said, we've got our friend Don Mitckess, Director of Clinical Strategy at Relief Mental Health, to kind of go over some of all of the services that happen at Relief. And there's some really, really cool things. I think Liz touched on a few of them, but some very, very interesting and cool ways to treat mental health, but specifically, you know, trauma, PTSD, all those things that we should really try to be focusing on in the work that we're doing for people. And then Ava Rafas, Language Access Resource Center at the DuPage Federation. We're going to talk about language. As I've said at numerous meetings, and as I've usually brought in my colleague Annette to talk about too, language is a barrier that I think a lot of people who are seeking those services run into. And you know, when we look at how are we expanding access to services, we should always be thinking about language. And we're going to talk a little bit about that and what they're doing to kind of help out people who are seeking services through the DuPage Federation. And at the end, if we have some time, we may do like some short breakouts or some conversations just to maybe look at some of the months ahead. What are we working on? Maybe even talk about some gaps that we don't see. It's good to talk to our members to kind of see, you know, in their life and their work, what are those barriers they're running into? Are there strengths that we don't know about? And who should have a seat at the table? So we got a jam-packed meeting. So let's go ahead and look at some of these upcoming meetings and trainings. Our DuPage ROSC presentation series is back next week. If you haven't attended these, this is a chance to kind of go deeper into a specific topic related to substance use or mental health. Sometimes at our council meetings, we have so much stuff to get to that we aren't able to dig in on presentations as much as we'd like. And this is that opportunity for us to do that. So next Wednesday, February 26th at 10 a.m., we're back with that. These meetings are Zoom only, completely open to the public. And like I said, we try to pick a timely topic, and I'm actually the one presenting next week. I'm going to be presenting on nitrous oxide. You may or may not have heard about the wild trend that's happening with nitrous oxide. Specifically, you may have heard the brand Galaxy Gas, which has kind of taken off overnight with a younger demographic, but it's not only the younger people that are using and abusing it. So there's a lot to get into. This stuff is being sold at vape shops alongside a number of different substances that are kind of straddling that line of legality, but that people can access. People can go and buy this kind of consumer grade nitrous oxide. And so we're already seeing through that trend people who are really struggling once they try to get off of that stuff. So we're going to dig into a little bit of it, the kind of the history, the use, and what we're seeing as those trends. So that'll be next Wednesday. If you're somebody who feels passionate about a certain topic in substance use or mental health, we're always listening to pitches. We've had everything from cannabis to stimulants to domestic violence to family and recovery. You name it, we've tried to get a presentation about it. So if that's something it sounds like you'd be interested in, feel free to reach out and we can get you on one of those meetings. The ROSC community survey is going to be closing down probably later tonight or tomorrow. If you hadn't had a chance to take it yet, this is a community survey that we've been doing in collaboration with IDHS Super. We've really been trying to dig down to find out some more information about things that align with these priority goals of ROSC in the state of Illinois. So those kind of 5 priority goals are stigma reduction, promoting medication-assisted recovery, so things like Suboxone, Vivitrol, Methadone, promoting harm reduction, so things like Narcan, all the way over to safe needles, so needle exchanges, ensuring effective service delivery, so hopefully we're doing some of that through our work already, but then also prioritizing equity. The information that's collected through these surveys are going to be reported back to the state, but we use them to kind of direct our efforts in the coming year. So I put up on the screen those QR codes for both the English and Spanish language versions of those surveys. It's super, super helpful for us for people to take this. So if you don't mind, if you've got your digital device out and you want to take a quick shot of that on your phone, you can take that later. It would be really, really helpful. And in fact, kind of towards the end of the meeting, I might put this back up on the screen for just a few minutes so people can take that kind of towards the end. Let's talk about Narcan. In the past year, you probably heard about a number of things that we've done in partnership with the DuPage Health Department, who have been just truly amazing partners in a number of ways, but really truly in the harm reduction sphere. They have kind of trusted us to go out and do outreach and kind of be the outreach arm in certain areas to find places where we can put these Narcan access points. You can kind of see in the photo there. This is a photo of the box that we have in place at the Glen Ellen Public Library, which was the very first library to take a chance on putting a box in DuPage County, which is pretty amazing. It was kind of a domino effect after that. As you can see, there's more libraries up there. But this is just the list of places that we were able to put in Narcan boxes. And then in the case of Glendale Heights, a full-on Narcan vending machine. It looks like a snack machine. You could walk in 24 hours a day, 7 days a week, and get free Narcan out of that. In addition, these other places, these are just the ones that ROSC kind of worked on. The DuPage Narcan program and the health department have done just knockout work on their own in creating kind of this service map, but also making sure that we're finding areas where these access points either don't exist. We kind of call those like the deserts, right? Harm reduction deserts. But we have re-upped our contract work with the health department for the next year. So if you work for an organization, or if you are part of an organization, or you know of a place that might make good partners for these, please let us know. We really try to make this as harmless as possible for the partner sites. We take care of the cost of the box. We can do install. We help out with refills of Narcan, you name it. We're really just looking for partners, right, to host these things. So if that's something that might be good for you or your site, please don't hesitate to reach out and ask us. Grief and loss. Grief and loss is one of those areas that sometimes gets forgotten about. I think we often treat the acute care of the person who's presenting with substance use, but there is so much loss, obviously, as it relates to addiction and substance use, specifically for the family, but even people who are treating their own addiction have suffered all kinds of loss through this stuff. So the second and fourth Thursday of every month, we do a Connection Through Loss grief group here at Serenity House, who is run by our colleague Felicia Maselli. That is at 7:30 p.m. Again, the second and fourth Thursday of every month, completely open to the public. Come on down and join us for that if that's something you would benefit from. We also do a Friends and Family Smart Recovery meeting. So this is Smart Recovery, which is that kind of CBT, DBT, goal-based recovery program, kind of works for people who maybe had an issue with the spirituality component of 12-step, have really, really responded well to Smart Recovery. This is that type of meeting, but for friends and family. So it's for friends and family who maybe kind of want to understand more about these recovery programs, but also they can kind of use it on themselves as far as healing some of their own trauma and doing some of the own work on themselves while they have a family member who's doing the same. So those are also open Thursdays from 6 to 7 p.m. here at Serenity House. Last one before I get my buddy Danny up here on the mic, but the RCO, which is the DuPage Recovery Community Organization, that is coordinated by our friend Danielle, who's actually on vacation, so I'm kind of going over some of her stuff. But they do a virtual Narcan training the third Thursday of every month at 12:30 p.m. If you've not had one of our Narcan trainings before, obviously beyond just the training on how to reverse an overdose, we really try to touch on trends that we're seeing. So not only overdose stats, but also adulterants that are showing up in drug supply, everything from like fentanyl, xylazine, carfentanil. We really try to cover all of those things. So if you've been trained before, that might be some new information for you. It could be a brush up, but this is a great like 101 Narcan training. If you've got a friend or a family member who could benefit from that, completely open the third Thursday of every month. All right, I am now going to ask my friend Danny Sorbis to hop on the mic. Danny is our Serenity House CORS program coordinator. I'll let him talk a bit more about what that is, and then also some of the meetings that are being done through CORS after I promote this last one, which is the Smart Recovery meeting at Stony Brook Center in Wheaton. This is every Wednesday from 1 to 2 p.m. Stony Brook Center, great MAT center, MAT clinic, but also they do a ton of recovery-related programming and meetings over there. Those are open, so if you're interested in SMART during the week, Wednesday, 1 to 2 p.m. And now I'm going to turn it over to my colleague, Danny Sorbis. So Danny, take it away.
Thanks, Jared. Good afternoon, everybody. Thanks for being here again in person and virtually. So I coordinate our community outreach and recovery support grant, that's long for CORS. Our priority populations are those who are unhoused or risk of being unhoused, those who have substance use or opioid disorders and other mental health challenges that go along with it, and those at risk of overdose, medical complications, or incarceration. In order to do that, we focus on harm reduction training and education, providing referrals to those in a timely need, doing community outreach, coaching services, and professional development. So we have partners in this room and online who are with us with CORS. Family Shelter Services. Alex is in the room. She's waving. Hello. Thanks, Alex. Part of what we're doing together with the ROSC is going out there next week to do a presentation for professional development, mental health, substance use, harm reduction, all in kind of one. So that should be great. We're looking forward to it. We also host a number of virtual or hybrid meetings. So the first one up here on the screen is our hybrid veteran support group meeting run by our very own Jim Murphy. He's a veteran coach himself. It is Thursday nights in person at Serenity House, but also via Zoom. The next flyer we have up here is our virtual Smart Recovery meetings. That's every Saturday morning from 9 a.m. to 10 a.m. We have a rotation of coaches who do that, and they do an amazing job. So if you have, if it's hard to get out of bed, or if you're, especially when it's this cold weather outside, jump on a virtual meeting on a Saturday morning if you need extra support. Right after that virtual SMART meeting, this is from 10:30 to 11:30, we have a virtual refuge meeting. So this kind of takes some Buddhist mindfulness meditation and some recovery principles. If you have not heard of it or tried it out, give it a shot. It's a really good resource. Appreciate you all. Thank you, everybody.
All right. Thank you, Danny. I am going to turn it over in just a second to my other colleague, Blake Warman. Blake handles quite a few things with me at the ROSC, the first of which we'll kind of get a short update, hopefully, about the ROSC Referral Hub. We actually had somebody asking right before the meeting started. If you're unfamiliar with the ROSC Referral Hub is, I'll kind of describe it real quick before I turn things over to Blake. But the Referral Hub was created about 2 years ago. The kind of story behind it was there was about 6 or 7 of us who worked here for Serenity House, who were kind of the de facto people that others would call when they had somebody they needed to get into treatment or detox or sober living or whatever it was. So we were kind of like running into walls left, right, and center because of all these barriers, right? So it was either we couldn't find beds for people, or the beds wouldn't work with certain insurances, or you name it, we would run into it. And so we said, there's got to be a better way to do this. Is there a better way to kind of get more people together who are working on referrals like this? And so over time, it kind of ballooned to the point where the group, just a text on the phone, it couldn't be supported by so many different carriers. Very weird. So then we had to move it over to WhatsApp, and that was 2 years ago. And now we're up to 130 plus people on there. So those are people just like constantly working on referrals for all kinds of different things. It's free and it's easy, and Blake will come up here and explain how to join, amongst other things. So I'm going to stop my share because he's also going to talk a bit about our ROSC resource guide and our ROSC resource map that he has been working for a while, and it's coming out amazing. So Blake, I'm going to go ahead and turn it over to you for a few minutes. Feel free to share your screen.
Thank you, Jarrett. I'll say too that my self-care was not checking email while I was on vacation last week. So we are up to 139 members on the referral hub. Given that I was on vacation last week, I don't have a full update for that. However, one of the outgrowths of the referral hub, which I'm sure many of you are aware of, was this resource list that I had made on an Excel spreadsheet. And this is good. This is great. It's very informative. I tried to make it as simple to navigate as I possibly could. If you're unfamiliar with Excel, it gives you some brief instructions with it. There are hot links to those pages, so you can scroll down and click on that. However, at the end of the day, this is still a spreadsheet. It does not work great on mobile. If you try and search on it, it's doable, but you have to know to come down, change this to workbook, and then type like Blue Cross Blue Shield, and then it will go. It's very awkward. And if you're in the field, you're not often going to have access to this. My ultimate vision for this was something that you could select variables from, and it would spit out a list of possibilities for you. That is, let me share my other screen. That is what this is. So all the information that is on that resource list is now on this map. If you click on one of the icons, you can see it has all the same information from services offered, special populations served, ages, the insurance, special entry requirements. The only thing that it doesn't have is the personal contact info. I didn't want to put that on here because this map might be shared more. So that I left off. If you have a copy of the resource list, it's still on there. One of the things that's great about this, not only can you see what's near you geographically, but the search function is so much better. So let's say that I want to search for Blue Cross Blue Shield. I type that in, I see all 13 results, and now it gives me a list of everything that takes Blue Cross Blue Shield and across multiple, I guess, genres. We'll go with that word. So everything from substance abuse treatment, which I use the martini glass for, to mental health, which has the green M, to sober living. And if you click on one, it will take you right to there. It will go over everything with it. They'll have a link to the website, like their general contact info, and it took all that straight from Google too. So all of that's perfectly fine to share. This is so much easier to navigate on mobile. If you have your cell phone on you, you have access to all the information in that spreadsheet in something that is much more user-friendly. Like it's night and day. This will continue to grow with the resource list, and I will still be doing updates to the resource list and mailing that out. Those of you who are on the referral hub and the mailing list, I will send the link to this map to you, so you will have access to it along with the copy of the newly updated resource list. This was why it's taken me a little bit longer to get the newest update out, but I hope that you guys find this as useful as I am happy with it.
Yeah, absolutely. Blake, one thing maybe if you could demonstrate too, can you show them how to click on and off layers? So like if nobody's ever accessed like Google Maps before. So there's obviously all the layers are on right now, but if you wanted to, you know, only search for substance use or you dealer's choice here on which one you want to do.
Yeah, sorry, I actually have that on my notes for something to go over. So with this, I can't have as many layers as I can different tabs on that referral hub. So some of them are combined into one, but let's say that you want to visually declutter all of this and you only want to search for mental health. You can check off everything else that you don't need. And now you are left with just the mental health listings. If you go to search for that. Okay, well, on the public one, it won't limit it to just that, but you still have access to all of the ones there. But selecting layers does give you a much cleaner list. It's great. It's so much more useful. I can add a couple more layers. This is still going to grow like the resource list. So as time goes on, there's probably going to be a couple other layers to this, but yeah, I think it's pretty good.
Yeah. Blake, you can share the link like in the chat, or afterwards if you want, I can mail it out too, whatever's easiest if you feel comfortable putting in the chat, Blake.
Yeah.
I do have a question from somebody in person. Where's my game show assistant? She can come up.
Hi, Blake.
Hi.
This is really cool. Thank you for building this out. Curious to know, does this also show, how many folks this resource was able to get folks connected to treatment? Like data on that?
The
Or is it
map itself, no. As part of the referral hub, that's what I keep track of with all the referrals that are provided on the WhatsApp. But because of vacation last week, I wasn't doing any work, so I don't have that full update. But those are two separate concepts, really. One's an outgrowth from the other, but it won't keep track of when a referral is provided.
So we tried, we're not tried, we're still trying. We track outcomes as best we can. So like if we know that there's a referral request that gets put in through the hub, and then we can kind of see that someone's connecting through there, we can at least know that, okay, well, someone, there was a direct referral for service. I think the last time we reported on it in a month, we had like 65 or 66 referrals to service just through the hub. In 1 month. Like if you expand that out over the course of the year, I mean, it's hundreds and hundreds we've been able to do, which is pretty insane. And that's where tracking outcomes gets more difficult because there's more, but then also we got to think about, to truly track an outcome, it would be like following up with each provider who was in on that referral in the hub. So we don't want to take time away from them. Like originally when Danny and I were doing it, we were like, please tell us, please. Like if you've, because we weren't going to we didn't have time, frankly, to track down each outcome. But Blake has kind of built it into the work he's doing with it, where we're able to do it a little bit easier. And this map was like, I don't know, for those of you who've been coming for a few years now, was originally created like 2 years ago. And it was just kind of out there. And then when Blake came on, I was like, here, take this, make it how you want, like make it better, please. And he's like gone above and beyond that. So the fact, and Mark Matthews is in the chat talking about it. He was one of the ones that has been here since the beginning when we've been talking about trying to find like better ways to make sure people can make these referrals. So yeah, the more info you can give us and feel comfortable with putting, either on the hub or on these listings, the better it is for us to make those referrals. Because really, look, we're all about lowering barriers, and I'll tell you what a huge barrier is. When people are looking for recovery services and they Google treatment near me, guess what? First 8 or 9 things are ads. After that, you get hotline numbers at best. Like these are huge barriers. So we attempted to get like direct contact numbers, people, if possible. This is the stuff that's actually going to create a more streamlined way to get people into treatment in a timely fashion. Anything else, Blake, to cap that off?
No, that's pretty much it. I tried to make it as straightforward as I possibly could and as user-friendly, so there's not a whole lot of instructions with it. If you can use your smartphone, you will be able to use this resource.
Absolutely. So yeah, if anybody wants that, you can put it in the chat, and then we'll make sure that we get copies of those sent out to you. And if you're somebody that's an organization that's not currently listed on either of those and you want to be listed, just reach out to us and we can put you on there. It's really, really not a big deal. So thank you, Blake. Really, really appreciate all your hard work that you put into that stuff. All right, next up, it is time for our organizational spotlight. If you've not attended one of our meetings before, during the council meetings, we really try to select at least one, sometimes two organizations that are working on the substance use or mental health continuum that are in our area, so people kind of know like what are the services that are out there. And this month, we're actually happy to have with us our friend Don Mitckess from Relief Mental Health. If you've been attending our presentation series meetings, you may have seen Don do a presentation. He's actually presented on transcranial magnetic stimulation. He's presented on other things before. Don, you may have to refresh my memory because it's been a few of them, but we're always thrilled to have him with us. He's the Director of Clinical Strategy over at Relief Mental Health, as well as an LCPC and a CRADC. So we're thrilled that he's gracious enough to join us for these things and kind of talk a bit more about all the cool things that are happening over at Relief. So Don, I'm going to turn it over to you, sir. Do you have any visuals you need to share anything, or do you want me to put up the
Yeah, I can
website
do
or
a share
anything?
I can do a share screen
Okay.
if that's okay. If you guys want to
Absolutely.
do that.
Absolutely.
All right, let's see. Let's see if my technology will cooperate. All right, let me start the. How about I start at the beginning? I'm going to make you guys dizzy. There we go. All right.
Perfect. Thank you.
Um, Thanks, Jarrett. As you said, I'm Don Mitckess from Relief Mental Health. One of my colleagues, Liz King, is on the call with us as well. Liz she's our professional relations liaison for the Western suburbs. So she is a go-to person. And between the two of us, if you're looking for a resource in regards to mental health, substance use, eating disorder, OCD treatments, and you're struggling to find something, we'll have something for you. We want to be your hero and help you out and get someone the help that they need. So feel free to reach out. But we're here to talk about what we do at Relief Mental Health. So Relief Mental Health is a series of outpatient clinics. We have 7 locations around Chicago, 2 in Wisconsin, 2 in New Jersey. The one in Chicago, we are in, our main location is in Oak Brook. We are in St. Charles. We are in Northbrook. We are in Rockford, Orland Park, and in the city, we are in West Loop and in Lakeview. And there's a reason for that. There's a reason why we have such a large geographic footprint, and it's really has to do with the types of treatment modalities that we offer. As Jarrett mentioned, I did do a presentation on transcranial magnetic stimulation, or TMS. I've also done one on eating disorders and one on non-suicidal self-injury. If you have an hour that you will never get back in your life, feel free to go and check those out on the ROSC YouTube channel. But specifically what we do, so TMS this is really one of our specialties, right? There are other providers that do TMS, but we've been doing it for 5 years, which in the TMS world is ancient history, right? TMS is a relatively new treatment modality. It was only approved by the FDA back in 2008. It's only really been covered by insurance over the past 6-7 years, and has slowly grown in acceptance by payers. Because it's something different, right? So TMS if you can look in the background there, you can see our machine, right? It's a machine. It's a medical device. You see that little tower, and you've got the 3 different dangling helmets. But inside each of those helmets is a magnetic coil. And what that magnetic coil is doing is sending a soft magnetic pulse to different parts of your brain, in order to treat a few things. It can treat a lot of things, but the things that the FDA in the US approves it for are treatment-resistant depression, obsessive compulsive disorder, anxious depression, and of all things, smoking cessation, right? So if you look at, there's different color helmets. The blue helmet is for depression, blue for the blues, right? So in order for it to be covered, someone has to have tried a couple of different antidepressants lifetime. They've had to have tried therapy. And if those things are not working to the point where they are still symptomatic in their depression, TMS is now an option for them. We're hoping one day it becomes a frontline treatment, but we're not there yet, unfortunately. So what the blue helmet is doing is it's sending those magnetic pulses to this part of your brain, because that's where things are a little dormant or asleep when you're depressed, right? So if you look at an MRI, the color blue is indicative of low neural activity. So those magnetic pulses are waking those neurons up and causing them to work. Get to work, guys. It's fire off. And when the neurons fire off, then they're generating those great neurotransmitters like serotonin and dopamine and norepinephrine, all those things that our meds are doing chemically. We're addressing it electrically, but we're not using electricity to do it. So the closest analogy I can give you is if you have a wireless phone charger, right? You have one of those little plates and you take your phone and you put it on the plate and your phone just charges, right? If you've ever wondered how that works, I'm about to tell you. It works on the same principle that TMS works on. So what if you opened up one of those plates, you'd see a small coil of copper wire. We call that a magnetic coil. And if you put an electric charge through that coil, right? Because you got to plug that wireless phone charger into a USB port or into the wall, right? It will generate a magnetic pulse field at a right angle from that plate. If there is something that can be electrically stimulated within that magnetic pulse field, that magnetic pulse field will electrically stimulate it, like your phone battery. That's how it causes it to charge. Now with TMS, what the magnetic pulses are doing are targeting your neurons and causing electrical stimulation in them, making them fire. No electricity is being delivered, but it's causing stimulation of that activity within the brain cells. So we're waking up that part of the brain that's depressed. Now, if you notice, there's a yellow helmet. The yellow helmet is for anxiety, depressive anxiety, and obsessive compulsive disorder. Now, that's targeting a different part of the brain. We're mainly looking at the medial line and back here. And what that helmet is doing, what that coil is doing, is it is, if you look at someone who's anxious or triggered in their OCD, if you look at an MRI, their brain up here is all lit up like a Christmas tree. What the magnetic pulse is doing is it's tuned slightly differently. So it's depolarizing or slowing down that neuronal activity. It's slowing down those neurons. It's telling, hey, calm down, chill out, man. So in order to do that, we are, again, magnetic pulses are causing this action to occur. So it's not like these helmets look scary. I mean, they're 1950s hair dryer looking things, right? And you look at these things and you're like, is that going to hurt me? And I got to tell you, it doesn't. What you'll feel is it feels like someone's flicking your head. Someone described that earlier. Flicking your head for 2-second pulses, 18 seconds rest, 2-second pulses. Now, the treatment regimen is pretty intensive. It's 5 days a week for 6 weeks. And then we titrate down 3 the next week, 2, and then 1, and then you're done. 36 sessions in total. That kind of regimen is necessary to get your brain to operate a little differently, right? To wake it up and to stay awake. Because we can wake it up, but it's got to stay awake once the treatment is over, once that course of treatment is done. Now, those treatments are only half an hour.
I'm so nervous.
The treatments are only about half hour each, right? So in our clinics, we will open early, we will stay late, 7 a.m. to 7 p.m. So someone can come before work, on a lunch break, after work, because it's only half an hour and it's not debilitating. So you can sit there, you have your treatment. We have a TV there. We can put up an episode of Seinfeld. You can play on your phone, work on your laptop, whatever you want to do. And the treatment gets delivered and you can get up and go about your day. Right? So how effective is it? 4 out of 5 people will say have a positive outcome with it. 79% is what the research tells us. And what we consider successful is if someone has at least a 50% reduction in their assessment scores, because we're going to be doing assessments like the Beck Depression Inventory, PHQ-9s, Y-Box for OCD, and that's how we measure progress. and whether or not we're being successful. So every Wednesday, people are getting these assessments, right? So we're able to track their progress. And if someone has at least a 50% reduction in those scores, and many people have a greater reduction in those scores, meaning a greater reduction of their symptoms, that's successful, right? With very minimal side effects. The one side effect that's commonly reported is in the first 4 or 5 sessions, people will report a headache. And that's because we're asking the brain to work harder, right? It's just like if you haven't worked out in a while and you go and you run a couple miles, your legs are going to be sore until you get used to that level of activity again. Same thing. Other than that, other side effects are very, very rare, and usually is a result of a provider that is not careful and adhering to the research on how to deliver this type of treatment. That is not us. We are very careful and we are very much in line with the research on how to effectively deliver this type of treatment. The third helmet, the green helmet, that's the one for smoking cessation. Now, here's where these 3 things are important, is that these are each affecting a different part of the brain, right? That's what we're targeting. Each coil is configured differently because we're targeting different areas of the brain. Now, because of the way that the coils are structured, we can affect a bigger area and deeper into deeper brain structures than other TMS devices can. We utilize a device by a company called Brainsway. Brainsway is an international company. They have machines all over the world, which means there are other parts of the world that are using deep TMS, which is what this does, for other indications other than what the FDA here in the US approves it for. There are off-label indications that are being utilized in Europe all the time. Their version of the FDA is called the European Conformity Mark. They have 21 different indications for TMS, not just depression and OCD and anxious depression and smoking addiction, opiate, alcohol, cocaine addiction, PTSD, tinnitus, traumatic brain injury, dementia, attention deficit disorder. The applications are remarkable, and there's good research behind it. Now, at Relief, we do off-label protocols all the time. If we're just doing it off-label, it's not covered by insurance, right? But if someone is coming to us for an on-label treatment, if they meet criteria for treatment-resistant depression or OCD or something that the insurance covers, we will and frequently do add a secondary protocol to address some of these other issues. We have some brilliant doctors that really just are very, they're constantly in contact with the chief medical officer at Brainsway. So we're up to date on all the research from all over the world on how we can effectively use this to help people who are suffering. Okay, so, I already covered this. Okay, so covered by we are in network, and this is covered by all major insurances, including TRICARE and Medicare. It is not covered by Medicaid or managed Medicaid, just so you know. The one exclusionary diagnosis for this that insurance will say no is bipolar disorder. If someone has a bipolar disorder diagnosis, the concern is that TMS would trigger a manic episode. It's one of those very rare side effects, but it does happen. And frankly, our folks aren't always truthful when they tell us about their diagnostic history during our intake. So we have had a couple people that snuck by, didn't share that they were bipolar. And a couple of people in our 5-year history have had triggered a manic episode with TMS. So we just frankly don't want to take the chance, right? Let's see. All right. Okay. Just trying to be mindful of time. Spravato. We're going to move on to that real quick. So Spravato is a form of ketamine. It's an isomer called S-ketamine. Now, full disclosure, I've been a CADC since a previous millennia. I've treated a lot of people for addiction. I've treated people for ketamine addiction. I had a lot of questions when I came to work for Relief. Spravato is very controversial in the recovery space, as it should be, because it is mood altering. It's a dissociative drug. However, after talking to the pharmaceutical company, talking to their docs, doing my own research, looking at the independent research, Seeing subjectively how our patients respond to it, I can honestly tell you, I am a convert. I am an old dog that has learned a new trick. This stuff works, and it works for treatment-resistant depression and major depression with particularly those folks that are suffering from chronic suicidality, chronic daily feelings of hopelessness and helplessness. Don't necessarily have a plan. If they have a plan and access to it, they need to go to the hospital. They need to be kept safe. But those that are living with these thoughts, intrusive thoughts daily, but are not at the point where they're acting on them, this medication can help lift them out of that very quickly and very effectively. It is also very, very helpful for folks that that suffer from trauma and being able to access trauma where they may not have been able, where they're having a difficult time accessing it or processing it just with talk therapy. The course of treatment for this is side effects. So if someone's going to have side effects because this is delivered nasally, this is a nasally administered drug. The side effects we're going to see are transitory and are going to happen typically in that 2-hour window after administration. And it's around things like increased blood pressure, lower oxygenation, right? So we are medically monitoring those folks for those 2 hours. Their appointments are 2 hours. They're with us for 2 hours, and we are monitoring them throughout the course of those 2 hours. They have to have a ride. They can't drive themselves back and forth to Spravato. They shouldn't be operating a car or heavy machinery until they've had a full night's sleep. As far as the dosing schedule, what does that look like? There's an induction phase where they come twice a week for the first 4 weeks. Weeks 5 through 8, they go down to once a week. Some people will stop at that 8 weeks because they've gotten symptom relief and it's persistent. Some people will continue to come in for Spravato treatment weekly, every other week, once a month as a maintenance drug. The thing about Spravato and for insurance to cover it, and insurance does cover it as long as they are on at least one oral antidepressant. It is not approved for monotherapy at this point by insurances. And they cannot have a bipolar diagnosis. Because again, the concern is that would trigger a manic episode. Now, there's not a lot of good support for that if it is done in a way that is careful and done on the depressive end of the bipolar cycle. Okay. But insurance won't cover it, which is one of the reasons we brought on in a few of our clinics IV ketamine. Because IV ketamine, we have very successfully treated people on depressive end of their cycle, and IV ketamine is a much more affordable option than trying to pay for Spravato out of pocket. Those little bottles that you see here, that's one of the, each of those bottles is stupid expensive, hundreds of dollars each, right? So, if you have insurance and it covers it, it's great. If you have a bipolar diagnosis and still want to look into it, then IV ketamine is an option for you. It's much more affordable. Oh, there we go.
Don, I hate to interrupt you, man, but maybe just a couple minutes. I have one more guest I want to try to get in at the last 2 minutes, so I'm so sorry to cut you off. I just want to make sure I'm cognizant of time. Thank you, sir.
Want to be mindful of the time. Last 2 things I'll mention: we do have med management services at all of our clinics, and we also have therapy at all of our clinics. So if someone is seeing a therapist or a provider and wants to come for TMS or Spravato, keep seeing who you're seeing. We'll just be an add-on. We'll be an augmentation to that. And so someone doesn't have to do, someone could do any one of the 4 services that we offer, one or all. We have people who have done all 4. We have people who just come in for one. So that being said, if you have, look, our offices are nice. There we go.
Beautiful offices, by the way. I always, whenever you show the pictures, I'm like, man, those look amazing.
And all of our clinics have a very similar design to them. So, and if someone wants to come for a visit and a tour and see the machine and see our space, we love nothing more than tour people. Get in touch with me or Liz, and we're happy to do that with you at any of our clinics.
I am putting my information in the chat as we speak so that if you have any questions, feel free to reach out to me. I'm giving you all my cell phone. That can be reached any time of day. I'm happy to do a warm handoff in a session with one of your clients. You can give my cell phone away like candy. Happy to help.
We get people in quickly. People will not
That's
wait.
great.
And
That's
then
great.
thank you. And there's a QR
Well,
code.
thank you both. Don, we're always thrilled to have you. You do such great presentations for us. So thank you for being such a great ally to the ROSC and being gracious with your time. And Liz, thank you for sharing your cell phone number. And I'm sure we'll try to get people connected to you. You guys are doing great work over there. So thank you for both being here. And thank you again, Don, for presenting. We appreciate it.
Thanks for having us. Sorry for being a time hog.
No worries. You guys are good. There's a lot to get to. With the last couple, like 4 or 5 minutes we have here, I did want to make sure that we went over to Ava Rafas, who's with the DuPage Federation's Language Access Center. So I want to bring her in, and I'm going to share my screen briefly because I do have a slide to share for them as we kind of talk about that barrier of language that we talked about previously. So I'm going to go ahead and put this up on the screen. And I will go ahead and turn it over to you, Ava.
Thank you so much. Now, I am not going to talk about that, what you have on the screen, and I would greatly appreciate if I can have your attention for a moment. If we would have more time, I actually was planning to talk about the importance of language access, as it was mentioned already that it can have a huge impact on who is approaching to receive services or how those services are delivered. And for those people whose first language is not English, it does not mean that they don't speak English at all. They probably do, but it makes a big difference which is their home language or which is their medical language or which is the language that is more comfortable for them to open up and talk about whatever is going on in their lives. And for that, language access through interpretation, translation is the best way to reach your target audience and make sure that people are getting the services that they need. I would say first, interpretation and translation are not the same thing. Interpretation is when we talk, translation is usually the writing. So how do you even make sure that people would be aware of your services or the help that is available if they are not comfortable in English? They would see your flyers in English, they would see your website in English, they would see your handout materials, brochures, whatever information. So the first thing is that really some of that at least should be in other languages. And I am saying plural languages because if only Spanish comes to your mind, believe me, you are wrong. In DuPage County, we have top languages, not even 5, but rather 10 in the whole entire county. So it's not just Spanish. It's not checked if you are done with Spanish. There are many other languages. If you are providing assistance, let it be in person or virtual, there is help available in various languages. And the reason I am here today, and I am happy to return, I used to attend your meetings and I was dropping off for a while, but I am back. That our organization is currently in possession of 2 grants that provides us funds that we can provide services at absolutely no charge to you. We can provide interpretation in person, virtually remote like Zoom, Google Meets, you name it. We can also provide telephonic interpretation. While the in-person and the virtual services are by appointment, the telephonic interpretation is on demand, 24 hours per day, any day of the year. You just lift up the phone, call that 800 number, you tell them what language you need, and they put the interpreter on the line right away. All these services at no charge to you. We also have scholarships
that are for interpreter trainings or interpreter courses, introductory courses. If you are a bilingual individual or you have any staff members or volunteers who are dedicating time to your organization, send them our way. They can go through the interpreter training or take that intro to interpreting course, which is a much lesser, commitment, and learn about the profession. That is also at no charge. Document translation. I started my little speech with that, but of course, this is something that we can do for you again. Not just documents. It can be any forms, reports, newsletters, flyers. We can even do subtitles to your videos, whatever you need. Both of the grants that we currently have access to have some geographical limitations. One would be assisting with Milton Township residents or organizations that are serving Milton Township residents, even if the organization is not located there or the organization is located. The other one is a similar geographic restriction, which would be for the CDH, Northwestern Medicine CDH service area. Should anybody be interested in exactly what towns and what zip codes are covered, I can provide you with that. Both grants are to support with language access, traditional and non-traditional mental health services. That would include all mental health services, substance abuse services, or services for individuals with disabilities. The funds can be support the providers who are assisting optimal mental health, and that is a nice big umbrella. Many, many things would be covered, including but not limited to. It could be substance use prevention, treatment and recovery, services for individuals with developmental disabilities. It could be any mental illness, therapy, consultation, so on and on. The funds can assist for clinical and non-clinical settings. So even if it is like a support group, a connection group, or any sort of like that, the services would be still at no charge, and we can help you with language access. I am asking that please reach out to us. Thank you, Mimi. Mimi already popped in the DuPage Federation LARC website that you can reach us, and the dupagefederation.org email address where you can reach us. I would be happy to provide you with more information, but time is very limited now. I was hoping I can share on the screen what the website looks like, how do you request interpreters, but that can be the second step. The first is that the information is out there now. Please contact us. And luckily, we have plenty of funds and we need to spend them by June. So as soon as possible, please contact us. We would be happy to help.
Yeah, Ava, absolutely. I will, again, I will share all of that information. I'll blast it out through our networks. I think that's incredibly important service. And what you said at the beginning, you nailed me, because you said it's not just Spanish. I always think top of mind Spanish is because of the population, but you're absolutely right. It goes way, way beyond that. So we need to be thinking more as far as like, who are we covering when you think about language services, not only the translation, but also the interpretive. So that, like, oh my God, I wish we had this service like a couple of years ago. We would have used it. Oh my goodness.
There. Cultural differences.
Yeah.
In many, many cultures, mental health, anything related to mental health is a huge stigma.
Sure.
And to reach someone in a language that is more comfortable to them and to help them to receive the help they need, that is huge. So please reach out to us. We would be happy to help.
Mimi, are you still on here? If you are, if you wanted to mention anything about this survey. So is this a way just to give feedback on this program?
I'm absolutely on. This really, for us, is just if you could just scan this QR code and take a minute to tell us what types of services you offer and where you might be experiencing language access barriers. This helps us do our job better. So it only takes about 5 minutes. We would love your feedback.
Absolutely. Thank you both so much for being here. Such an amazing service. So we'll try to make sure you get that money spent by June, because you gotta You gotta spend it to get it, right? That's the name of the game. So thank you both. Thank you to Don for presenting. And thank you to everybody else who came here for this meeting. The next meeting of the ROSC Council is going to be on Wednesday, March 12th. We'll be back to our normal second Wednesday. And actually, our friend Nicole from Recovery Centers of America is going to join us to kind of spotlight their organization. But we'll also be talking about the reporting from our community survey. So hopefully we'll have us a bunch of cool stuff to share with you on those findings. And then remember, next Wednesday at 10 a.m., I'm presenting on nitrous oxide on Zoom. So if you're interested in that, completely open to the public. Thank you, everybody. I'm going to, if you don't mind, I'm going to put the ROSC survey QR code back up there towards the end here. And if you don't mind taking that, if you haven't already, be hugely helpful. And everybody else, have a great rest of your week. Stay warm, and we'll see you next month. Thank you.
Thank you so much for the opportunity. I popped some information in the chat box, but Jared, I am going to email you that whole entire thing too, if you could please include it in the next communications. I appreciate it. Thank you.
Absolutely. Absolutely. Thank you both. We'll see you at the next one, okay?
Hey, Jared,
Everybody.
can I ask you a favor?
Let me unmute first. Yes.
I just wanted to share, I know that we've got like very few people on at this point, but it is pertinent to what we've been talking about today. We have a webinar coming up that involves, it is about self-care. And it
Nice.
is in Spanish. So
Oh, great.
I did put some information in the chat. I don't know how many people like really read the chat. I'm going to copy and paste it from above and put it in again. Is there any way, so it's March 11th, so it'll be before like our next meeting. Is there
Okay.
any way it could be like shared a little bit more broadly with everyone?
Absolutely. So I can, I usually do follow-up emails after these meetings because there's a lot of stuff that gets shared. So I try to collect it all, the stuff that's shared at the meeting, and then blast it back out. So I can do that. And then I can also talk about it next week at the presentation series meeting. So yeah, there's a few ways I can do that, but I'll make sure I blast it out before then.
That'd be awesome. Yeah, you started with like, we're to talk about self-care and language. And I'm like, oh my God, this is like my day. So yeah,
Planets
we're
have
super
aligned.
excited
Yeah.
about it.
Absolutely. Yeah. And yeah, thank you. Yeah, we'll be sure to share that for you.
That'd be awesome. Thank you so much, Sharon.
Okay. Yeah. Everybody have a great day. All right.